Children's Mercy has earned a national reputation for the level of care it provides in our various specialties, departments, and divisions. And in fact, we've been recognized by U.S. News and World Report in having been ranked in all 10 specialties this past year. And one of those specialties is gastroenterology. And we're so happy to be joined by Dr. Jennifer Colombo, who is the Associate Division Director of Gastroenterology and Hepatology and Nutrition. I hope I got all that right.
You did, very nice.
Dr. Colombo, thank you for joining me this morning. It's great to have you here. And maybe we can start off by just talking about how this team interdisciplinary approach to care is really brought to life within the GI division. Can you talk a little bit about that?
Yes. Well, first, thank you for having me. I'm excited to talk about my division. Our GI team consists of over 100 members, where we partner with psychologists, dietitians, social workers, nurses, nurse coordinators, you name it, in order to care for children in the way that we feel like they should be cared for. Over 50% of the children that we see in gastroenterology and liver care are cared for within a multidisciplinary program or team.
What are some of the accomplishments that you are most proud of in terms of how you've all delivered care in the GI division?
The biggest, most impactful program that has gotten up and running this year has been our liver care and liver transplant. So far, there have been no severe rejections and no graft failures. So we are incredibly grateful to that team and the care that they're giving the children. And all but our most recent patient is at home, and many are going to school. So it's very exciting for us in our liver transplant teams.
That is wonderful, and I couldn't agree more. I think our liver transplant program, which, as you point out, is an inter and multidisciplinary program. I think the conventional wisdom is it's a surgically driven program, and while our surgeons play an important role, it is truly inter and multidisciplinary, including significant involvement from hepatology and GI and other disciplines. So
yes,
we're very proud of the progress that we've made, and thank you for your leadership on that. How are we advancing our quality improvement initiatives within GI?
We take care of over 700 patients with inflammatory bowel disease, and we are part of Improve Care Now, which is a national community collaborative, which basically takes data from our patient visits, analyzes, reviews the data, and then feeds it back to us so we know how we're doing compared to other pediatric centers, compared to our disease remission rates, our rates of steroid use, our rates of nutrition in children with inflammatory bowel disease. Children's Mercy has been recognized by Improve Care Now because of our patient and family advisory committee. We have families and parents who are incredibly devoted to our inflammatory bowel disease program, and they have set us apart from other centers because of our involvement of the parents and families. The other hallmark that I'd like to talk about a little bit, if we have time, is our comfort promise, where we mitigate or eliminate pain associated with painful procedures such as a blood draw, an IV placement, or a vaccine. And, even in my clinic, children say that they don't want to come to the doctor because they're afraid that they're going to get a shot. And we are trying to eliminate that with our comfort promise, utilizing Child Life, utilizing topical medications that can help minimize pain associated with it. And we're trying to spread that not only from within our division, but also outside our division.
I'm so excited to hear you talk about the importance of engaging our family members through our family advisory board and our family advisory councils. That calls to mind something that I think is so indicative of our culture here, and that's storytelling. Telling amazing stories about the impact that we have on the quality of life of a child and the family. Do any stories come to mind where sort of our mission has been brought to life, and the model of care that you describe is brought to life with a specific child.
Absolutely. And there's a lot of stories.
Yeah.
I don't know how much time we have, but a little girl was airlifted to Children's Mercy in April 2020, and she came because of an acute GI bleed, and she was admitted to the intensive care unit and got phenomenal care by our pediatric intensivist, but she kept bleeding. Required many transfusions, and we could not determine where in the GI tract she was bleeding from. And so this took a team. We talked about team before. This is another exemplary moment of how our teams come together. So I had the pediatric intensivist on my side, the surgeons, my GI team, my GI procedure team, as well as hematology, rheumatology. Even the social workers and the chaplains came to the aid of this child and family. I remember one critical day where the child was too critical to even go to the OR. And I and Jason Frazier, one of my surgical partners, were standing shoulder to shoulder in a very small ICU room. The child was being monitored by our pediatric intensivist, and we were doing a combination endoscopic and surgical procedure on the child. We were able to identify the place of bleeding. She left our hospital, walked out of here with her family after about 3 weeks. And I had the privilege of seeing her a month later via telehealth. And the dad just showed me in the background how she was playing on the floor. And he said, she acts like this, nothing happened. Nothing happened. She's a beautiful, happy little girl. I will never forget it. I know that her father will never forget it. But it just highlights our team collaboration and the work that we do here for the children.
I have to tell you very honestly, that's one of the most powerful ones that I've ever heard. I was sitting here just mesmerized listening to you tell the story, and for me it just brings an incredible sense of pride in our organization, because those stories are occurring every single day here. So Dr. Colombo, let's switch gears just a little bit. As you know, one of our most important journeys here at Children's Mercy is related to diversity, equity, and inclusion. How is DE&I being applied and addressed and talked about within the GI division?
We are very aware and making intentional efforts to increase our diversity, equity, and inclusion. We need to be able to recognize these health disparities, and you can't see that just by looking at a person a lot of the times. I'll highlight our multidisciplinary celiac disease clinic as really kind of a shining example for us. The treatment for celiac disease is diet management, changing your diet, being gluten-free for the rest of your life. There's no prescription for that, and we don't have insurance companies paying for food, even though we've prescribed it. So our celiac disease clinic has started a food insecurity screening just this past year. They've screened over 500 patients and families that come into the clinic, and they've partnered with community programs and resources to help connect these families to programs that offer low cost or no cost gluten-free food specifically. And again, trying to help increase the access and awareness so that families can get the recommended treatments that we're proposing.
I think that's fantastic, and those are beautiful examples of how we bring our DE&I journey to life for the benefit of the child. And it also exemplifies how important it is for us here in Children's Mercy. While we'll never lose sight of how we provide care to the child during that episode of care, we're also very focused on how we can improve quality of life and the health status of populations that we care for in communities, especially communities where children may not necessarily have equal access. So talk about how we're incorporating research and discovery and new advancements into the GI division, and how we're leveraging our desire to really create new discoveries that can be translated quickly to the child's care.
Sure. We have, last count, we have over 70 active research projects ongoing within GI. And I think one of the most impactful is our partnership with the Genomics Center, using collaborating with Genomic Answers for Kids, diagnosing GI conditions and GI diseases at the genetic level. It has been an incredibly great partnership. We are actively researching in areas of abdominal pain, polyposis, and inflammatory bowel disease, as well as liver and drug delivery systems.
You know, I'm so glad you brought up Genomic Answers for Kids, which Children's Mercy had one of the very first pediatric genomics programs in the country. And now, as we advance and leverage our genomics program through Genomic Answers for Kids, we can safely say that we're one of the largest pediatric genomics programs in the world now. Looking ahead over the next 5 to 10 years, what do you see as the future of gastroenterology and related disciplines? And what are some of the opportunities we'll be looking at and pursuing, and maybe some of the challenges as well?
Well, you know, we still need to stay dedicated to our multidisciplinary care. I mean, I know we've talked about the psychosocial aspects of GI disease and liver disease, and we can't lose sight of that. But I think over the next 5 to 10 years, taking our currently small but unique programs, such as our Polyposis and hereditary cancer program, as well as our neurogastroenterology program, and elevating those to the next level.
You know, one of the things we are evaluating right now are those types of programs for which there are very few centers in the country that have the capabilities to provide that level of subspecialty care to kids, and really to leverage them so that we can create better access to those clinics and programs. And so I think that's such an inspiring note for us to end on. Dr. Colombo, thank you for your leadership. Thank you for the amazing care that you and your teammates provide to our patients and families every single day. Thank you for joining us, and we appreciate all of you taking the time to listen today as well. Thank you again, and we'll see you soon.
Thank you.